Definitely joint pain is a lot less. I get it sometimes. Like I was in pain yesterday, but the day before I like overdid it because I went for a long walk in the morning and then we went for a family walk in the afternoon. So I knew that I'm going to be hurting, but it was a walk that my kids were waiting for because I couldn't do it with them before. So it was like I was like, you know what, I don't care, I'm doing it, because I want the kids to be happy again. I didn't have heartburn for the past couple of days. My skin, I still have the red butterfly rash a little bit, but I used to get like under my skin, I used to get like pimples. I don't get them anymore. And my hair is like, I don't know if you can see, but my hair is like awesome now.
Yes, it looks like you have a lot of hair, right?
Yes. I was losing it and now it's coming back. The swelling went definitely down, like on my face.
Yes, very good. And I can see that as well, that you from the first call we had, that it's you're looking much better and healthier and vibrant.
I'm so happy my sister found you girls. I got, I found out what I have and I was like, oh my gosh, I was like down for like 2 days. I was crying in my bed because I was so afraid, and everything that the doctors were telling me that, what's going to happen and what kind of medication they're going to put me on and all this stuff. So I freaked out. And then she's like, oh, why don't you try those girls, listen to their Facebook thing? So I did, and thank God.
Well, I'm glad that you decided to do it and your sister was there to help you with that.
The rheumatologist that I went to, remember a couple weeks, 2 weeks ago or something, he gave me a script for all the blood work and everything, but I didn't go. I want to go until I'm done in 2 weeks. I made an appointment for blood work in 2 weeks on the 20th because I wanted to see, how my blood work is different. No, I didn't want to do it 2 weeks ago when he told me to do it. He said that if it comes back the way that it was, 5 weeks ago, he's going to put me on steroids and he's going to put me on anti-suppressants medication, but I don't want to take it.
Yes, so exactly, this is a way for you to reverse, because what we teach you is the medications, it suppresses your entire immune system, inflammatory part and anti-inflammatory part. It's the whole thing is suppressed. But what we're doing is we actually shutting down the inflammation, and then we give you tools to create anti-inflammatory, healthy immune system that stops attacking your own cells. So this is a much different and better approach for cellular healing. People who are not doing the program and they're getting sicker, they have to go on medications because they're not doing anything else. You are doing something else that's actually helping you to heal from inside out, which allows you to be able not to take the medication. So that's why people take medications, because they're not doing anything for healing. This program actually stops the progression of disease. It stops the progression, and it also gives your body the tools to heal itself. So that's why you can avoid the medication when you do the program. People who are not doing the program, sometimes they have to take the medication if they're really progressing rapidly. So you actually reversing it. That's why you can avoid the medication. We'll see where you are in like 2 more weeks, because I think you still have halfway, right? You're like 20.
Tomorrow is 4 weeks.
Yeah, so you still have 2 more weeks, and anything can happen. You can make more progress, but when you go to your doctor, we'll see what your labs say, but your labs can take a while to change.
And I don't feel like tired like I used to. Like I would come home from work and I would just sit on the couch and I didn't feel like doing anything or falling asleep, or even during the day I would fall asleep. I don't do that anymore.
Very good. So thank you, Monica, for sharing that. And I'm glad that we had this call with you. Please reach out to us for any questions you might have, okay?
Okay, thank you so much, girls. I really appreciate everything. Thank you. Do you think that lupus or any autoimmune, this is 100% genetics?
Autoimmune disease, it's both genetic, but it's mostly environmental, based on the experience, because what we are changing in the program is we untrigger your genes. So your genes need to be triggered. So we are untriggering the genes. And also we are changing the environment of your cells. So it allows your cells to heal. So you actually, when it says reversal, it means your symptoms and your labs go back to normal. And our clients who have reversed it, they're able to tolerate inflammatory foods like wine or bread without getting the disease back. So that means you're fully healed. And you will be able to do it once you generate enough healthy cells in the body to tolerate those things. And that's why we recommend our clients to continue on the program until all this disease is gone. It's better not to have a diagnosis, because if you ever wanted to have like a retirement plan or insurance plan, it's like the disease is always there. You don't always get like the best premium plan if you have had a disease. That's why it's better to heal and not know that you had it, so you can have a good plan. But regardless of that, just do what you need to do to get your health back, so you wouldn't have to worry about it in the future. So this is the way to do it.
Okay, thank you so much. Appreciate the phone call.
You're welcome, Monica. It was great seeing you. I know it's getting dark in there, and the lights went down, but it was so great seeing you. So say hello to your family from us. They probably know you're doing this. And
oh yeah, they know.
Yes. So say hello to us, and we're really excited for you. You're doing an amazing job. Okay.
Thank you so much. Appreciate everything. I really appreciate it. Thank you.
You're welcome. Talk to you soon.